Afternoon, good evening, everybody. I wanted to talk about COVID-19. Recently in Africa, the cases have been rising, so I wanted to actually alert you of the signs and symptoms. So the common symptoms of COVID-19, number one, it's fever, which is usually ranged between 95 to 100%, fatigue, a dry cough, loss of appetite, body aches, shortness of breath, like that means you're having difficult in breathing, mucus, sore throats, headaches, chills, loss of smell or taste, diarrhea. Then the emergent symptoms, these ones you need to see a doctor or go to a hospital, which are trouble breathing, constant pain or pressure in your chest, sudden confusion, mhm, sudden confusion. Then other symptoms of COVID-19 are pink eyes, swollen eyes, fainting, coughing up blood, clots, seizures, heart problems, kidney damage, liver problems. So basically, you should stay at home unless you need medical care. If you do need, go and call your doctor or hospital first for guidance. Then tell your doctor about your illness. If you are if you are at high risk of complication because of your age or other medical condition, they might have more instructions for you. Then you can actually isolate yourself, which means this means staying at home, away from people, such as possible, even members of your family. Stay in a specific room and use a separate bathroom if you can. Wear a cloth face covering if you have to be around anyone else. This includes people you live with. Sit up and drink plenty of fluids. Over-the-counter medicines might help you feel better. Keep track of the symptoms. If they get worse, seek medical attention quickly. Then I'm going to talk of what does shortness of breath feel like. Having tightness in your cough, can't catch your breath, you can't have enough air in your lungs, you can't breathe deeply, you have work hard than usual to breathe in or breathe out. If it is COVID-19, flu, cold, or allergies, since they see the same symptoms, it can be hard to know which condition you have, but there are a few guidelines that can help. You may have COVID-19 if you have a fever and trouble breathing, along with the symptoms which I have listed. If you have any problems in breathing, it might be flu. You should still isolate yourself in case. It's probably allergies if you don't have a fever but your eyes are itchy, sneezing, and you have a running nose. Okay, sorry. So how to protect yourself from COVID-19? Take these steps. Firstly, wash your hand often, at least 20 seconds each time with a soap and water. Use an alcohol-based sanitizer with at least 60% of alcohol. With at least what? 60% of alcohol. If you don't have to soap and wash. Then limit your contact with other people. Stay at least 6 feet away from others if you have to go out. That means you have to stay a meter away from others if you go out into, be it shopping malls, hospitals, wherever it may be. Then wear a face mask in public place, like the one that I have here. Then you must actually avoid people who are sick. Don't touch your eyes, your nose, your mouth unless you have just washed your hands. Regularly clean and disinfect surfaces that you touch a lot. Thank you. Yeah, I think those are the basics. So if you follow the stages, you actually prevent yourself from actually contacting or getting infected by COVID-19. Basically, stay at home. You can actually call Uber or call your shops so that they can actually deliver the items that you might want from the stores. So basically, stay at home and make sure you keep maintain social distancing, and because the cases are currently increasing. Yes.